Diabetes mellitus is a fast-growing global health problem.
China, with a population of 1.4 billion people and with a substantial increase in the diabetes population from 90 million to 140.9 million during 2011 to 2021, according to the International Diabetes Federation, currently has the largest number of patients with diabetes worldwide. A Guangzhou Biobank cohort study showed that 1,261 of 11,473 participants, accounts for 11%, developed incident type 2 diabetes during 43,430 person-years of follow-up. Therefore, the challenge that diabetes posed to Guangzhou is considered one of the most significant examples in China. In Guangzhou, diabetic patients face two main issues: isolated data island and extensive management. Firstly, medical records are rarely shared between departments and hospitals, and health data is seldom analyzed comprehensively, leading to wasting a large amount of medical data. Secondly, due to a lack of medical resource and non-personalized treatment plans, patients were incapable of optimizing their health care. Moreover, patients were unable to manage their health data, preventing them from sharing it with doctors and family, which results in paying less attention to their diabetes status.
Isolated data islands lead to poor treatment results, which then cause poor adherence. Extensive management also results in it. Poor adherence, in return, leads to poor treatment outcomes, creating a negative cycle.
In response to the problem of isolated data island and extensive management, our team launched a platform,
AI Dianet. The first function of the platform is to exchange information through FHIR standards to build a patient personal data profile. The platform breaks the informational barriers and promotes the informational exchange between doctor and patients. At the same time, patients have the right to manage their data files and need to authorize doctors and parties to view them, which using the multi-signature system.
The system is based on NEM blockchain, a new generation of distributed database that maintains a continuously growing list of ordered records, called blocks. NEM blockchain is both secured and compatible, and it employs multi-signature contracting. For instance, the patient would control two keys in the contract. Each healthcare entity included in the contract associated with the patient's account would hold one key. The patient will have full access to personal data and control over which entities it is shared with. This ensures the active participants of database patients and thus increases their compliance.
Based on patient personal profile constructed through the FHIR standard, our platform has developed the second function,
Glycodynamic forecast, a personal AI model of a patient. The original glycodynamic forecast was generated by the data of patient personal profile. Then the glycodynamic forecast will update itself by incorporating patient glucose, monitoring data, and other health features.
In the patient portal, there are 4 function pages: enter data, AI analysis, messages, and personal information. On the enter data page, patients can manually input their blood glucose data. They can also synchronize data automatically via paired glucose monitoring devices. AI analysis is to present the theoretical and actual treatment effects to patients. Glycodynamic forecast analyzes the data related to the prescription and medical order to predict the treatment effects of patients during a period of treatment. In addition, it reads the daily blood glucose data of patients,
obtains the actual treatment, and feedbacks the results to the patient. In this way, glycodynamic forecast can find out whether the patient is adhering to the treatment and whether the treatment plan is effective.
Messages is a page where a patient can communicate with doctors and other parties. In the doctor portal, there are 2 functions.
On the My Patient page, doctors can view the files of the patients they treated. If a patient's glucose levels are abnormal, a right triangle appears.
AI analysis' primary focus is to assess whether the treatment plan is suitable for the patients, enabling doctors to prescribe the appropriate medications.
We are closely collaborating with Wisher AI on the project. Wisher AI has already developed a series of public health management systems and has good cooperation with School of Public Health, Sun Yat-sen University, and Guangdong CDC. Although many blood sugar management products have emerged and some regions have begun attempting to share medical records, solutions like AI Dianet are still rare.
This innovative system seamlessly integrates multiple groundbreaking technologies and the AI intelligence dynamic monitoring model, glycodynamic forecast. It comprehensively addresses the needs of both patients and physicians, setting a new standard in healthcare. Firstly, AI Dianet has developed the innovative intelligent dynamic model, which provides patients with a visual tracking of their condition.
With data accumulation, this model can offer forecasting services, combining historical, real-time, and predictive data to monitor patients' conditions and provide positive two-way feedback. This can improve patients' treatment enthusiasm and improve adherence. Additionally, it can assess and manage the risk of complications with clinical data, reducing the potential harm to diabetes patients. Secondly, for medical institutions, compared to the existing data integration systems,
AI Dianet utilizes interconnectedness based on standardized datasets, significantly improving the use of historical big data and resolving the issue of repeated diagnosis. It also provides doctors with auxiliary medical opinions, greatly enhancing their work efficiency. Thirdly, AI Dianet employs blockchain as a supporting technology, taking advantage of its decentralization, security, and permanence.
This can not only protect patients' privacy, but can also ensure the authority of information within the chain. Overall, compared to existing models of offline regular checkups, self-screening at home, and follow-ups by medical staff, AI Dianet can not only reduce waste of personnel deployment and medical resources on a material level, but also can encourage patients to actively improve their compliance on a mental level. AI Dianet as an independent system can be integrated as a supplement to various hospitals' hospital information systems. Its functions and page design can be modified appropriately based on each hospital's need to reduce usage barriers.
During data migration, attention should be paid to standardization principles and data quality monitoring and backup. Based on the new system and the original system, appropriate interfaces should be developed for functional integration.
To overcome barriers about using technology products, particularly for elderly individuals, we have several methods. Firstly, we will design an instruction combining with text and graphics, which could be easily understood. The instruction should include basic digital skills such as navigating through the device's interface, using touchscreens, and understanding the application.
Secondly, setting accessibility functions may greatly enhance usability. This includes voice control, gesture-based navigation, and customizable settings that cater to individual needs and preferences. Thirdly, simplifying the user interface of the devices is essential. This contains enlarged icons and text size, and utilizing high-contrast colors for better visibility and streamlining the overall design. Furthermore, we will develop intelligent guiding functions to help visually impaired persons use them smoothly. In the first 6 months, we will cooperate with medical institutions and recruit patients with chronic diseases in a community in Yuexiu District, Guangzhou. Subsequently, we will popularize the use of the model to them, while collecting and analyzing data to prove the feasibility of the program. In the next year, the collected information will be analyzed and the errors in the model will be corrected. Furthermore, we will expand the project to other districts of Guangzhou. In the third year, we hope to extend further to other cities and even the whole country and collect feedback to improve the model. At the same time, we hope to be recognized by more medical institutions and patients. We have outlined a budget of 1 million. Here are the details.